Lead poisoning in our kids is a statewide problem. According to Wisconsin's Department of Health Services, in 2016, 5% of children tested under the age of 6 had lead poisoning. Let's compare that to Michigan. Remember, this is the state with the Flint water crisis. That's where 3.6% of children tested had lead poisoning. The embattled Milwaukee Health Department has made changes since then, but we wanted to get a pulse of the progress in the medical community. Dr. Heather Parody is a pediatrician and the medical director of community services at Children's Hospital of Wisconsin. Thanks for being here, doctor.
Thank you for having me.
So you're telling me that you're seeing more kids going to the hospital for lead poisoning now than before?
That's correct.
What do you think is behind that?
Well, not only here in Milwaukee do we have higher than the state average number of children who have elevated lead levels, we have also seen those children at the top of the lead spectrum, those with the highest levels who are in need of inpatient hospitalization, rising every 2-year period since 2013.
This has to be concerning. Now that there's more attention on this and the health department is making changes, you would think this would be the opposite, that not as many kids would be going to the hospital, right?
Well, I think that this trend just underscores the necessity for early prevention and testing and the earliest intervention possible.
What is it like to have to tell families that their kids have lead poisoning?
It always comes as a surprise to parents when we break the news to them that their child has had lead exposure.
Because there are no symptoms.
Positive. That's correct.
No symptoms, but what are the side effects of lead poisoning?
So the side effects, especially in young developing brains, are lifelong. And it results in learning difficulties, in behavioral difficulties. And those last into adulthood, unfortunately.
So the only way to really find out is to get tested?
Absolutely.
So where do you go from there after the test?
So some of the next steps oftentimes depend on the degree of elevation. If it is mildly elevated, say in the 5 to 10 range, we are oftentimes screening, making sure that the child is not anemic, treating that if there is anemia present, discussing the environment and any potential sources of lead. So we know that in terms of environmental risks, that lead dust, peeling, chipping lead paint, and the dust that it causes either inside the house or to the exteriors of homes, washing into the soil outside the houses, is oftentimes the primary source of exposure for children. Lead in the water is another possibility as a secondary source.
But when you say that our community is losing focus, what does that mean? What are we doing wrong?
Parents readily identify paint hazards in the environment 9 times out of 10. And I believe that that is where our primary focus needs to be.
It's a very serious situation for our kids.
Absolutely.
Doctor, thank you. Well, parents, we do have 2 chances for you to get more information on lead if you're looking for it. The City of Milwaukee Health Department is hosting 2 Lead Safe Milwaukee resource fairs. Those are coming up this week. One is Wednesday evening from 5:30 to 7:30 at Bradley Tech High School. The other is Thursday, that's the same time, at North Division High School. They'll pass out kits and water filters to eligible families. Coming up, the next race for state Supreme Court and the candidates already gearing up for 2020.